bit of general environment that our community should take advantage of or is taking advantage of. I'm so excited to join with you today on the show. With me is Daktari, who is going to lead us into sharing the inspiration or the discussion with me, and I'm sure it's going to be a blessing. What's important is to understand ourselves and where we come from and where we are going, and that's the most important thing. And I want to just say thank you to the director of the show, who is Kelvin Kibet. My name is CKS. Please take time and follow us on the social media, leave a comment, share whatever, send a comment or a question. We'll be able to use it in our interactions. Thank you so much. Welcome, Dr.
Asante.
Good morning.
Good morning.
Yes.
Yeah.
It's an honor for you to find time to come on the show.
It's my honor to be here.
Let's begin like this. The proverb of the day. No matter how long the winter, spring is sure to follow. Can you tell us what you understand with that?
Yes. And unlike what they say, tomorrow never comes, tomorrow has always come. So, difficulties are not forever. There's always, like what Swahili says, baada ya dhiki ni faraja. So we always look forward. Yeah.
That's nice. Yeah. Our viewers have never interacted with you quite closely, and they'll be interested to know who Dr. Amin is. Just take us through a brief introduction of yourself and what you do.
Okay, people in Bungoma know me as Dr. Amin, in short. Dr. Amin, full name's Amin Ali Sheikh. I'm a businessman in town. I started my business in 1984 with a small chemist. Now, several years after, we have a chemist, an agrovet, a hospital, and we run an estate business, real estate business. Yeah.
That's quite a bit of strides you've made. Before we go to real estate and agrovet, let's do a bit of healthcare. As a practitioner in the region, can you just tell us a bit of the experience you've had?
As a private hospital business person, and in an area, in a region where affordability is lacking amongst the community, it's a very tricky business. So most important is to build trust within the community. That's the first important thing, so that the community can see you are an honest, reliable, consistent service provider. Most important is actually to be not punitive in your charges, to be affordable.
Okay.
Yeah.
Most healthcare facilities use the chemist side as the biggest cash stream. You started by a chemist. This is a follow-up question.
Yes.
Started by a chemist, then you branched out into the main hospital. You can enter this business from any direction, right?
Yes, exactly.
As you do that, there are other lessons you've learned along the way. Kindly share with the viewers.
As a young man, I didn't want to continue with the government. Yeah, because of very many things. Maybe another time we'll discuss about
yes,
that.
We can do that. Yes.
So we wanted, the whole family, me, my wife, my cousin, Dr. Mahmoud, we wanted to go into private business. Affordability was a problem. I was a professional. I'm a dentist by profession. At that time, I could not afford 150,000 to buy my chair and pay rent. My wife was a pharmacist. My cousin was a doctor, medical doctor. So we started with him first. He had a clinic in Mumias, and then from there we opened the chemist. So the first chemist, the real amount we started with was 6,000.
6,000.
And after putting up the building together with the shelves, the counters and everything, 6,000 shillings had gone. So the next problem was, how do we get medicine? But like I've said before, earning trust from the people is very, very important.
It's very important, yes.
We just found medicine coming to our shelves, and that's how we are. And that's my experience up to today. Yeah.
Now, when you look at the region and look at the sector, what are the biggest investment opportunities?
The health center, that is.
Health sector, yes.
Yeah. There are so many gaps in this region in terms of healthcare service. For instance, cancer treatment is not there. So oncology department is very, very important.
Okay.
We have dialysis all over, but believe it or not, we don't have specialists to run those machines. Yeah, so
that's another
specialized dialysis services would be most appropriate.
Okay.
We, on the area of maternal and child health, again, that's the area that is lacking. There's a big gap there.
Okay.
Orthopedics and mental health services. I don't know how many psychiatrists we have in this region, but I'm sure there are not more than 2 in the whole region.
Okay.
And we see a lot of suicides, we see a lot of depression, we see a lot of mental issues coming up.
Wait.
Yeah.
2 psychiatrists?
That's what I'm guessing, because I'm not sure. Maybe there's one here, and maybe Kakamega. But
wow. And we're dealing with a population of about what, 10 million?
Yes. Western region is 5.5 or something like that.
Well, they keep on telling us those numbers, but we also have to tell them our numbers.
Yeah, exactly.
Yeah. It's all right. So, when we look at a private hospital, mostly it's skilled labor.
Yeah.
Okay. I've been privileged to run a hospital in a management position.
Yeah.
One morning I wake up, 8 nurses have resigned. Yeah. So skilled labor in private health care is one of the big problems. What is your experience, and how can you, how can you guide practitioners or healthcare investors to handle that kind of challenge?
Maybe I can say what I've been doing in my hospital. Turnover of staff is a real big issue. People are always looking for greener pasture.
Yes.
They are looking for tenure of service. In government, it's more secured. So most of them would stay in private hospital, waiting
an
to go
in the government
sector. Yeah. So what we've been doing is to offer both subsidized community package, and we do the community affordable packages, balanced with high prime care. Now we balance with those two. Why we do that is we encourage a flow of inpatients and outpatients in our hospital. That gives us more income in place. Then it provides us with, apart from profitable services, it also gives us a leeway to engage more staff. Okay, so when you have more staff, that's one way of buffering that issues. So should one or two nurses or clinical officers leave, we always have others. But most important is to ensure that these staff are incentivized by training. We sponsor them to do trainings. We allow them leeway in their work time. Okay, so that there's that loose arrangement that they can work within their own timing.
So they have the freedom to be at work and also concentrate on what they can do on their own.
Yes.
That's interesting.
Yeah.
Way back in 2010, I told you about my experience in hospital management. We didn't have a universal or a hospital management system that combined all the cash centers. We had an outpatient, then we had, when you wanted to do financials, you have to come out of that and then go into the accounting. Then after that, you have to come back again if there is a referral to the lab. You have to come out, those kind of things. Technology, give us the strategy you have, how to bridge that. And is nowadays there are enough software systems, management systems. We developed one, by the way, and then we were able to do that. Nowadays across the counter there are very many. But then on the equipment side, can you just share your experiences?
Okay, I think one important thing that Elgon View has done, we have developed our own software.
That's very important.
Yes. This very same software is now being used in the country by about 60 or more hospitals.
Wow.
This software has been adapted by RUFA. In fact, the software is called RUFA-Soft. Yes. So ultimately, yes. So we are a member of RUFA. So ultimately, we intend to have this software being used by all hospitals in this country. We are in the process of integrating it with the SHA. So software technology is very, very important in the hospital.
Yes.
First of all, it reduces the lost records.
Yes.
Every now and then you go to the archives and you find, you cannot find records maybe because there are so many in the store and you cannot retrieve or they're lost or they're burnt or something like that.
Yes.
So cloud saving, it's very, very important.
And
because you can always,
equipment that you get nowadays come ready for that.
Yes.
Those days you could not integrate a management system to, let's say, a lab equipment.
Yeah.
So nowadays, the equipment side, how is it?
Equipment is very good.
Because they also come ready, they can actually communicate with the management system.
Yes, exactly. So equipment are very good. They're so much advanced nowadays. Storage is very, very good because before then you would have to upgrade the whole machine or do this or that. But right now, with clouds, you can have a small computer, a telephone, mobile like mine. Can do the work. One good thing is you can go with that mobile phone or a tab to the rural areas.
And it will still, as long as it's network, telephone network, you can always interact with the system.
Yes, exactly.
And then the diagnostic machines, like the X-ray, are they been uploaded on your system, or you have to come out of it? Then you start now uploading.
No. Everything. In fact, our hospital right now paperless.
Paperless.
Yes.
Okay.
So all the X-rays, CT scan, including machines, even the lab. Yes. We used to have Lancet with us, and we would receive results within 2 hours.
That's interesting.
From Nairobi.
That's interesting.
Mm.
So there is the chief,
Yeah.
and then there is the SHA.
SHA.
One will see the opportunity and partnerships, but then it will also come as a threat to cash flow.
Yeah.
Because when you are treating a patient who is on insurance, this insurance, the capitation has come to change a bit of that. But then the normal insurance, which now SHA is trying to do, is not giving capitation the way NHIFO will do. Or maybe they're doing it, I don't know. But they'll wait for you to treat, then they pay you. So by the time they're paying you, as in this patient came a month ago, you treated, he went, so today they're paying. So that partnership can be very good to the community, but it offers a very big threat to practitioners.
Yeah. But I would encourage people not to fear SHIF or SHA. It is a very good instrument. I think people are confused by the tier system in the hospital management and the UHC, plus now what we call SHIF. Okay, these are different entities.
Okay.
Yeah. Universal health coverage.
Yes.
It's a very, very important aspect of our clinical.
Wait.
Yeah.
So it is UHC that has capitation?
No, first of all, I'm talking about different systems.
Okay,
Let's understand.
Okay, tell us. Okay.
So, universal health coverage is a very good philosophy.
Okay.
Very important. How you do that through the system of tier levels, it's very, very important.
Okay.
Yeah, where you have small dispensaries down there and health facilities coming all the way to level 1, 2, 3, 4, 5, up to the referral system.
Yes.
These are very good systems. Okay, but now what manages this system is the SHA.
Okay.
Okay, and that's the animal in the room. Yeah. So even SHA, if it is, because SHA is a government thing. Government has the muscles, has the wherewithal of registering all Kenyans. They have the law on their side. So in terms of registration, the government can do it very, very well.
Okay.
Other insurances, yes, they do, but you see now they are compartmentalized. You know? Yeah, like you will have Jubilee, like for instance in towns like Webuye and other small towns, they will not be there.
Of course.
Okay, but
because
SHA,
they don't have the traffic.
yes, and it's not profitable to them to go all the way to Mount Elgon to register 2 people. Okay, and have all these problems on them.
Because of course they thrive on coming to a corporate organization like ours.
Yes.
They get many numbers in one place.
So like
and then they send them in one place also.
Like in Bungoma, how many corporates do we have?
We don't have much.
You see, so
and some of those that are there are self-insured, like Kibabi.
Yes.
They don't have their own fund.
Yes.
Yeah.
Yes. So you will not have many. Okay. But SHA can do that universally.
Okay.
Yeah. So in that way, it increases the flow to the hospital for affordable treatment.
Okay.
Yes. So that's very advantageous. Now the threats, like you're saying, is in payment. We are not getting paid on time. The rates, like you have said, the capitation and so on and so forth, they keep on playing about with them. Okay. I know, for instance, what I do when I do root canal treatment, that is the treatment of teeth. If I'm comfortable and the patient is treated very well, I would need around 15,000 shillings per treatment. We've come down to 10 because of what I've said, affordability. Now it is being reduced to between 6,000 and 8,000. We have,
Shah can only pay that.
we have instruments that are supposed to be used once. But we cannot do that. We sterilize.
Okay.
You see? So that's one area.
Okay.
When you come to surgicals and these other issues, it's the same thing. You see, so those are the threats that are there within the Shah system. And I think the biggest threat is politicization of the system. That's a very big threat. Education and health. Siasa isiingilie.
But then the government keeps on assuring us about, well, I think even the government assurance is also political. Yeah. You see, there is a when times goes. Every year comes up with an update in the systems. Now we have something called telemedicine. The digital technologies that support delivery of healthcare services. And we would like to talk about them.
The RufaSoft, the software that I talked to you about, that was developed by Rufa, actually is trying to have a component of that. And that's very, very important. You don't have to have a diabetic patient, a non-diabetic patient or high blood pressure patient coming all the way from Sirisia to Elgon View just to have his pressure done and to see a specialist on a certain day. You see, telemedicine can solve that. Yes, with what are they called, community health providers. Yes, they can do it there, and then they can SMS, use USSD or whatever method the person is
that you don't need a smartphone to do
that. You don't need it. Just a simple phone. And you can talk to your specialist directly, and then they can advise you what to do. Adjust the medicine or tell you to buy other medicine. Or now ask you to come when it is necessary. So that one is very, very important. Then secondly, it reduces the jam in the hospitals. Because if we can do telemedicine efficiently, these small ailments can be. But I think most important is with telemedicine, you can pick diseases. It acts as an early warning system in healthcare. Whereby somebody who has had a mass or swelling or something like that can easily be told, now this has reached this stage, now you need to travel to come to the hospital. Without wasting time.
Well, maybe someone like the banking sector, when they were trying to encourage people to do banking outside the banking halls, it tended to reduce the prestige of going to the bank, so to speak. Maybe the issue of going to the hospital is more attractive to someone than just, I'm unwell, I'm at home, and they're treating me here, those kind of things. I think it's mindset.
People will be used to that. Like when I came in the beginning, when I started business, I had to see my manager every month, at least twice or 3 times. I was not feeling secure, not seeing my bank manager. I thought maybe he would bounce my checks or do this. So I wanted to maintain that
relationship.
Yes. But right now, a bank manager came to my office, and he was transferred here about 3 years ago. I have not met him. So I met him for the first time when he came to my office. Yeah, because now my phone
does the trick.
Does everything. I transfer a lot of money from my phone.
Mm-hmm.
Yeah, to pay my suppliers.
Okay.
So even that, people will get used to it. Yeah.
Okay. So beyond primary health care, what other specialties do you think need to be boosted in the region so that the region enjoys the delivery of healthcare services? But I also want you to respond to a very important question where the number of beds in the region is, I don't think we have over 1,000 beds in the whole region. If we do, maybe 2,000 max. If we have an outbreak, let's say in the insurance world, they keep on telling you, they tell you a problem, then they add very quickly in that God forbid. Now, should we have an outbreak in the region that demands serious interventions? Just tell us a bit of what's going to happen.
Yeah, okay. If you can remember during the time of COVID,
yeah,
we were able actually to respond. Kenyans are very good at improvising, but we're also very good at doing politics. Because immediately after that we forget, and because during COVID time we had a lot of that's when we bought a lot of machines, you know, for ICU. Okay, but I'm sure most of those machines are not working right now, and it's not because doctors are negligent or the hospitals are, but it's just because we like to react for the moment. Yeah. So if we can leave that attitude and do proper planning for healthcare,
yes,
yeah, then I think we would be okay. About beds, like in my hospital, I have over 60 beds, but most of them are not approved for NHIF, for SHA. So you see, when you count the beds that have been approved versus the beds that are really there, I think we are adequate. We can handle issues.
Wait.
Yeah.
What do you mean approved by SHA? As in, what kind of beds are supposed to be approved?
My hospital carries the capacity is over 60.
Yeah.
Yeah. I have those facilities. But now the approval, they could only approve a certain number, lower than that. Yeah.
Now that's the politics of it.
Yes. This is what I'm saying. And you know, when we talk about politics, it's not only politics, it's politics. Politics is very healthy, but we like to say siasa mbaya.
Maisha mbaya.
Yes, siasa doesn't have to be mbaya. A positive political interest is very good and healthy for the country. Yeah, politics where you think of development and you compete in development. The government should compete with the opposition for development.
Yes.
They should not compete for selfish interests.
Actually, they compete on abusing each other, which is very...
Yes.
It's also a competition. So.
Yes. Yeah.
Interesting. Can you tell us a bit of the most compelling reason you would encourage someone to put money into the healthcare sector?
Yes, I would. Like we said, there are many gaps. Okay. We don't have oncology departments, working oncology department. We lack psychiatrists in this country.
Yes.
So in the areas of specialities,
Yes.
Western region is lacking. And those are the regions investors must come and, or even the county governments if they want to. Yeah, they should invest in those areas. Yeah.
Talk about the possibility of public-private partnership in the healthcare sector?
It's very important, very, very important. Yeah, we should embrace it, but there should be proper structures. There should be proper legal systems where the two can be engaged.
Mm-hmm.
Yeah.
Before you talk about something else, can you talk about preventive? How is Urban View supporting preventive?
We have social media platforms that we normally educate our people.
Okay.
Actually, we attend very many barazas around the county.
Okay.
To talk to people about diseases and how to prevent them.
Mm-hmm.
We do medical camps. We have blood donor campaigns.
Mm-hmm.
Our hospital, of course, it's 24 hours.
Yes.
Like many. So we believe from this, when the doors are open,
Mm-hmm.
people can come in anytime.
Anytime. Okay.
And when you have a flow of traffic like that,
Mm-hmm.
you pick out diseases very fast.
Mm-hmm.
And therefore you are able actually to prevent
Okay.
diseases.
You see, let's talk about general capitalism in the region. You see, you gave us a story of how you started way back in 1994.
Yes.
By the way, that was the year they did the cutting to
Is that so? Okay.
It's a very significant year to me.
It's good I've reminded you of something great.
Now, traditional cash crops in the region is coffee, tea, and sugarcane.
Yes.
But
and maize.
Well,
later
maize,
on,
we stopped talking about it as cash crop because we eat like 89% of what we harvest.
Yeah.
Trying to imagine these cash crops. Do we get to a point where we need to start working on our mindset? Because, of course, there is the political side of the conversation, but then there is the realities on the ground about the presence of these cash crops and how they relate into cash.
Okay. Yeah. Now, for one, if you look at all these three crops that you mentioned, tea, coffee, and sugarcane, these are crops that you plant and wait to harvest.
Mm-hmm.
Some of them 18 months, others maybe longer. And they are not crops that you can go to the market here and sell and get cash immediately. These are crops that you have to sell them to the factory, the company, the exporters. Okay, so it has created a sense of dependency on us. Okay, you are a slave to Nzoia Sugar Company.
Yes.
You are a slave to Mumias, and so on and so forth.
Or maybe a slave to
coffee cooperatives, and you see how they mishandle our crops every day.
Yes.
And meanwhile, you are helpless. You sit and wait for those 18 months. They bring you fertilizer, they bring you people to weed, and so on and so forth. So at the long run, they've given us a mindset of helplessness and that dependence, like I've said.
Yes.
So you feel you have to be attached to somebody for your life to be okay.
It's not helping us be creative.
Yes, more so because the returns are very low. So it's tying us down to poverty, day in, day out.
Whoa.
Yeah.
are we condemned to be there? Can you talk about other non-traditional cash crops like horticulture, fruits, vegetables?
Actually,
maybe a livestock?
Okay, if you go around the whole of this region, people who have more than 10 acres are very few. Most of us have 2 acres.
Yeah.
3 acres, 5 acres at the most.
You're right again above me, 2 acres,
yeah.
Good.
Yes. So many actually will have 1/4 acre, and that's where they plant sugarcane, or 1/2 acre. You see?
Maybe a stem or 2 bananas, and that's it.
Yes. And the returns on investment are very low. So you have said rightly, the most important things to do is now to get rid of those and do horticulture. You see, you go from immediately after Athika all the way to Meru.
Yes.
You'll find people planting mangoes. Mangoes are plenty now in those arid areas.
Because the returns are higher.
They are very high.
And once they arrive,
and like I've said,
a factory.
Yes, you can go to the market here and put down your merchandise and sell.
So the idea is to have money circulating more frequently.
Yes, within.
Than waiting for 2 years to get
Yes,
money.
exactly. But the same mango, if you don't have money, you can pick and eat. It will fill your stomach. You'll be okay. You cannot eat sugarcane or tea or coffee.
Okay.
Yeah.
Yeah. You can do sugarcane, but not.
Yeah.
What do we do? You see, the real estate. We talked about you being an investor in the real estate.
Yes.
The coming of county administrations 15 years ago brought us a lot of middle class in our communities.
Yeah.
Traditionally, they were concentrated in Nairobi, but again, we see a bit of them with disposable income, and that will have translated into immediate real estate boom, but it was not. The uptake was not very as desired. Reasons being, some of the people who work in the county government come from the rural.
Yeah.
They would rather they stay in their rural homes, or if someone has to stay in an urban setting, you'll actually buy land and put up an urban house there, a townhouse there. So with commuting, so they don't take advantage of real estate. That has suppressed the boom in real estate in our region. That's my thinking.
Yeah.
I don't know. Am I? We wishing it were that way, or what is the picture?
Issues of real estate, especially in the urban areas, depend on so many things. One is how fast is urbanization in that area. Second is the infrastructure, the sewage system, water reticulation, electricity, rising income within that area. Because if there's no income, people will not.
They can't take advantage of
the uptake will be low. Yeah, so that's an area. So it is the duty of the county government to make sure that these things are in place. Urban planning is very, very important.
Yes.
You just don't put up rising building. For instance, affordable housing is a very good philosophy, very, very important. The only problem is you want to pick low and middle income earners and put them in the middle of a city on a high-rise building of 10, 20 stories, which needs a lift. Lift needs to be serviced, it needs electricity. It needs water to clean.
Yes.
Okay. All those people, they have wastes to discard. You don't have a
system must be
in place and working. You see, the garbage collection system must be in place and working. I'm sure you have seen before this, we had county government houses and council houses, municipality council houses.
Yes.
If you looked at the condition of those houses at that time, or even now, very deplorable. You see? Now you want to replicate that one in an even more complicated system that has 1,000, 2,000 people in one place.
The support system is not in place.
Yes. So once we do the proper supporting system, then we can do those buildings. Between resident and commercial, commercial has more income. It is steady, though low, but steady and consistent. You see, commercial will depend on several things. How that town is performing in terms of economy. You see, because if the economy is low, then nobody would come and invest in that place. So right now, residential real estate business would attract more steady income over time, but low.
Wow.
Yeah.
Does that mean, you see, like low to middle income earners in the community are the same ones who are, you see, they have the numbers.
Yeah.
But then they don't have enough income to do investments. So we are condemned to be employees.
Yes.
As a community.
Yeah.
I don't know. My thinking will be different, though I will need your guidance on this. That the big numbers we have in the region is all but workers.
Yeah.
We don't have investors. So the real wealth in the region is in a very few people who have come in to invest. Like people who started this journey in the 60s and invested in our community are the same ones who are controlling the wealth. We don't have new money coming in. We only have old money in the region.
Yeah.
That kind of capitalism also perpetuates poverty.
Yes, it does. Yeah.
What is your thinking around how can we change that story?
Okay.
You see, there is no major. We cannot have a major supermarket coming to invest in Bungoma. Why? Because who will buy? No one. Okay.
Yes.
Because we don't have a major organization coming to invest in this community because the cash we spend is very little. It cannot support that system.
Yeah.
So we don't attract investors.
Okay. So one, I want to disabuse ourselves with the thinking that we should all be business people.
Okay.
That's a very wrong premise of thinking. There are some of us, even people who go and do commerce, not all of them enter into the business. They're all employed. You see, we are created by God to be different.
Okay.
Okay.
And we must celebrate that bit.
Yes.
That our uniqueness and
yes.
diversity.
Yes. So there are some of us who would be good in business, will be driven towards that end. There are others who are good in
supporting that.
Yes, supporting that, and we must support them in that. You see, that's one thing. Because all along, the government has had this wrong and misplaced idea that let's have hustler fund. And the hustler fund is given to each and everyone in this country.
You can start selling something and stuff.
Most of these loans, they go to actually serve our subsistence, our day-to-day needs, you see. And they don't end up in businesses. And that's why we fail actually to pay back these monies, okay?
Because we consumed what we earned.
Yes.
We didn't invest.
Yes.
When the money came, we used all of it as food.
Yes.
We didn't create them into mothers to give back.
Yes. So while we've been campaigning, the NGOs are there, the government is there, politicians are there, encouraging everyone to do business. We've had that drive as a citizen, that this is the way to go. You see? So we have the drive, but we don't have the interest. We have the drive to do business, but we don't have the skills. We have the drive, but we don't have the training to do business. You see? We wonder why, like you said, the traditional investors have remained the same. And we wonder why it is so. But we don't realize that those children of those investors are trained from childhood.
They're prepared for the position.
If you can recall, before or immediately after independence, all the Asian shops would be written Merali and Sons. Hello. That one alone is a teaching to that boy. Because when he goes to school and comes back and see, that's my shop. It's my shop and my dad's. So already that idea of business person has come to him.
It's embedded
in him. Okay? Like I've trained my children, during the weekend they have to stay in the shop at the chemist here.
Okay.
And we go away. We go on holiday. And they stay there when they were in primary. And they control the shop. So this child who receives 1,000 shillings and he knows he has to give change of 600, he realizes, when I get 1,000, that whole 1,000 is not mine.
Yes.
I have to return 600 to somebody. So he will not squander that 1,000.
And the 400 that has remained in the shop, not all of it belongs to the shop.
Yes.
Because chances are 200 or 300 of it.
Yes. So mine is only 50 shillings. So he knows that. He learns that right from the beginning. But now you take somebody who has not learned that and you pump him with money, 10,000 shillings, 3,000 shillings, and you expect him to have the discipline of a businessman.
Of course, first thing I'll do is I'll buy a suit.
Yes. Yeah.
Now, what do you suggest? I think mindset, right?
Yes.
Mindset is what comes into.
Yes.
We have to work on it.
We have to.
I wonder who should drive that? Ourselves? Because our politicians have failed us. They're not going to do that.
No. Our politicians have not failed us. They've tried, like I've said, we have the Hustler Fund now. The good intention is there. Okay, we have our MPs, the senators, and so on and so forth. You would see them wanting actually to develop the thing. But I think right now what we should do is first of all to realize that out of 10,000 people that you want to help, only 10 people will be business people.
Not everyone.
Not even 5,000. Only 10 people. So yes, bring all of them, train them, like what CBC is doing, with the idea only to pick those very 10 people and develop them further. Okay? And the politicians must partner with business people, organization like Chamber of Commerce.
Yes.
Okay? Like do mentorship programs, create incentive for these 10 that we have picked.
Yes.
Okay? Recommend to the bank, because what is hindering businesses now is capital.
Yes.
Okay, and while running a business on a loan is very tricky, I would discourage anyone to get a loan to go and do business.
But that's
because
what we're doing, paying borders on loan.
Yeah, now let me tell you, interest alone is around 20% of the bank. Okay, then you have tax. All the taxes that are there, about 15 of them on a business person. On top of that, you have the salaries to pay. On top of that, you have the business rent that you have to pay,
yes.
Utilities.
Yes.
Okay, add all that, it comes to around 30%, 35%. That is an overload to you. Okay, so if you have to sell, how much would you sell? You would have to put a markup of over 60%.
For you to make it.
Will you sell?
And no one is going to buy. That show,
Yes.
they didn't buy it.
Yes. It is the same thing we do with maize crop right now. 2 acres will cost you around 57,000, and you are getting as a return 65 or 80,000, and you have waited for 3 months. This is what we'll be doing when you take a loan from the bank. But what Chamber of Commerce can do, the business people in town, if they cooperate, okay? These students that have been picked by the Chamber and the area MP,
yes.
could be seconded to a business in town. Then the businessman would become the supervisor of this. Yes, on apprenticeship arrangement. Yeah. Then the businessman will write a confidential report to Chamber, to the MP. Now this report will be used to recommend to the bank that we have trained this boy or young lady, we have observed him or her, she's okay, she's ready, ripe to do business. If she wants or he wants 10,000 shillings, give it to her. Yeah.
That will eliminate the barriers we keep on talking about, access to credit, stuff like that.
Yes, yes. But you see, the banks, I will not blame them. You see, it's a very risky business. I'm giving you 10,000 shillings. I'm not sure whether you are going to pay me or not.
That's the problem.
And then you want me to put my interest very low. I'd rather get paid from the interest in 6 months, and then you default with the capital, but by those 3 months, my interest will have paid me back my money, and when I follow you with the advocate and auctioneers, that money will be paid by the money you will pay now.
So that's how you guys can ensure that wealth is being
yeah.
But then it also has to be a coordinated approach. It's not what you can think alone. You need the support from the political side.
That's what I'm saying.
The county assembly, the county government.
Yes, that's what I'm saying. The politicians must not take everything as politics.
Yes.
Okay, they have to trust business people in the town. Even if I want to become a competitor of an area MP, yes, I have that right to do it. So the MP should not hinder me because maybe I'm in chamber and I want to help the youth. Let's come to work together. The way Raila and Ruto now are working, these are enemies.
Yeah.
But they're working together, and we are seeing where the country is going. Actually, we have had a lot of positive results since the two came together. You see, same thing can be replicated locally. Politicians, they can come with the businessmen. During the time of development work, we must not undermine each other. We should be sincere in what we do.
Yes.
Yes, let's develop our youth. Let's develop businesses in the county.
What is that one thing you recommend county administrations to do to ease doing business in those jurisdictions?
So sorry, you're saying?
The one thing
Yeah.
that county governments should be able to do to improve the ease of doing business in their jurisdictions. For example,
we have had, I don't know the official name here, but I think it is under Governor Lusaka, the first Lusaka.
Yes.
I don't know whether it continued after that or not, but I'm sure it's not effective. Okay, we had a liaison officer of some sort, okay, who would see that the way of doing business within the county is facilitated in such a way that it is smooth and very fast. Okay, so first of all, we need somebody within the county government to understand why we are saying running business in Bungoma is very expensive. Business permit is the highest. Even Mombasa is very low. It's lower than Bungoma.
Okay.
Yeah, and we've kept on telling these people that, and it seems they don't understand. It's because they don't have experts on ground to look at that. So this hinders very many young people from doing business. I was with somebody day before yesterday in Malakisi, and he wanted to open a business. And he tells me, when I went to town for a business permit, they're telling me to pay 15,000. Now I have 10,000 shillings to start off my business, and you're telling me to pay 15,000. Then how do I do my business? Yes. So that's one. Secondly, this office must coordinate investors. An investor should not come all the way and go and meet the governor. For what sake? You see, an investor must be handled with officers down here. He comes, he's told ABCD is needed in this place, and all those ABCD must be things that are practicable and easy to do. We have had several occasions of investors coming here because the bureaucracy of starting a business in Bungoma is so lengthy that they go away to Eldoret, they go away to Kisii, Busia and other places. And losing like this every now and then hits us economically.
But then you see, when you talk about investors coming from outside, when we have investors within,
yes,
what are we doing with these investors? There is a excuse me. There is when Raila was the Prime Minister, he had a round table with some group every other time.
Yeah.
We don't have a round table as business community with the governor every other time. I think that will go a long way in sorting out some of those messes.
Exactly.
We investors in the community, in Bungoma itself, in Western Kenya itself, can be able to drive the economy to as it can grow the economy.
Yes.
But then we discard them and start going to the Middle East, to America, to bring investors who have no idea how Bungoma looks like.
Yes, exactly. That roundtable you've mentioned is very, very important. The investors, the business people, we recognize in this county. Go to any public participation meeting and count for me 10 business people in that place. You will not find.
You are not invited, we don't know whether it's second place, or you don't want to go.
Yes. No. We are invited, but when you are invited, you are going to meet with goons. People who have been told which side to support. Like somebody like me would not like to go and waste my time when I know we will be about 5 of us and the 50 cheerleader people, okay, who are ready to oppose and shout me down whenever I talk.
So it becomes useless.
Yes, it becomes useless.
Of course, it will go down to history that the business community, we did public participation with the business community.
So when it comes to matters development, matters business, economic growth of the county, let's put our selfish interests aside. Let's put politics aside. And this goes to both the opposition, the competitor, and the in-sitting politicians.
Yes.
Okay? Let's come together and work as one. Because even a competitor will not benefit to abuse a sitting MP he will not benefit much from that. But he will benefit if it helps that MP to develop his area. Because people see. People, they see you. They see, yes, you have come to this area and helped my MP to do A, B, C, D. But now if you're fighting, what actually is hard is that
you are hindering the progress of that community.
Yes, and Mwananchi is the one who's suffering.
Dr. I can't let you go before talking about FDI. You see, foreign direct investments in the region. Give us the opportunities that exist.
Opportunities are very many.
Because right now we are enjoying dollars from our people who live in diaspora.
Yes.
That's the only thing.
Yeah.
Do we have anything else?
I'm not sure we do. Yeah. But it would be very important in from investors from abroad to come and partner with us.
Okay.
I'm not for the idea that these investors must come and be given all the facilities, space, you know,
to set up enterprises on their
at the extent of Mwananchi. But it should be so that they are encouraged to come and partner with the local people. Let them bring the dollars. We will work to multiply that dollar.
Okay.
Yes, that's how important it is.
In one sentence, 1 minute actually, I'll give you 2 minutes.
Yes.
The ultimate vision for growing wealth in this community as you finalize.
Okay. This will be to transform Bungoma and West Kenya into a competitive agro-industrial and services hub where inclusive private investment in value-added agriculture, affordable housing, and healthcare creates quality jobs and shared regional prosperity.
Okay.
Yeah, so that would be my contribution to that.
Thank you so much.
Yeah,
thank you so much, Dr. Amin.
Yeah.
I look forward to engaging with you a lot more so that we take our community ahead.
Thank you.
Thank you so much for staying with us. Our time is far much spent. We've come to the end of the show. I look forward to seeing you again next week on Tuesday. And as I requested you earlier on, whenever you are on our social media, X at WestTV_Kenya, Facebook is West TV. You can also follow me at Mr. Kitui on my X handle, or you can always talk to me at my Facebook page, Okwasimiti6KS. On behalf of Calvin Kibet, who is the director of this show, I want to say thank you and see you next week.